Welcome to the Scan and Plan Tool instructional webinar. This video series was developed by the Chronic Disease Prevention and Control Program at the Nebraska Department of Health and Human Services. The intent is to provide organizations with a comprehensive understanding for how to effectively complete and utilize the Scan and Plan tool. This particular video provides background on how we developed the Scan and Plan tool and how it pertains to your work. We thought it might be helpful to start by providing background on the type of work and funding that our program has, as that often provides some framework or understanding for the types of projects and tools that we then utilize with organizations like yours. The Chronic Disease Prevention and Control Program currently has two cooperative agreements with the Centers for Disease Control and Prevention. They're often referred to by their grant number, so you might hear us refer to them as the 1815 grant and the 1817 grant. They're slightly different in the types of work that they do, but what is similar are the intended long-term goals and impact of those funding opportunities. The hope is that through both cooperative agreements, our program, and thus Nebraska, is able to reduce the risk of people developing type 2 diabetes and improve diabetes, hypertension, and cholesterol management among those who have those health conditions. Both grants also are focused on identifying and hopefully tailoring interventions to address priority and/or high burden subpopulations. You might see different language in some of your tools or documents from our program, somewhat based on the grant or the intervention that you're working on, but really the intent is to start making headway on addressing health disparities when it comes to chronic disease conditions. Both cooperative agreements have a set of what we call grant strategies. Essentially, the strategies are approaches that CDC thinks will help states reach the outcomes that I mentioned on the previous slide. Strategies could include things like formalizing referral networks or processes, or increasing access to evidence-based programs, as well as participation and retention in those programs. And again, many of those will have a focus on priority and or high burden subpopulations. The grant strategies are often what we fund local or other state entities to carry out within specific communities, knowing that they're likely to have a larger impact than if our program were to try to influence a variety of organizations and communities in Nebraska. Ultimately, the strategies from our cooperative agreements are what frame your scope of work with the Chronic Disease Prevention and Control Program. To then assess the progress and impact of those strategies, we have additional requirements through our CDC cooperative agreements. The first are performance measures. The performance measures are indicators that are set by CDC for all the funded states and territories under both cooperative agreements. Essentially, CDC set performance measures for each of the strategies, and states and territories are required to report them generally twice a year so they can see the progress across the nation with regards to all of the grant strategies. In some ways, it's the way that CDC can do an apples to apples comparison or evaluation of the work being done through the cooperative agreements. The second component are the evaluation reports. Within those, we're asked to highlight areas of efficiency, effectiveness, sustainability, and impact of the interventions. That allows us to better tell the story of what's working and where there might be areas of improvement, either at the local, organization, or state level, when it comes to implementing the grant strategies. The hope is that through the culmination of performance measures and evaluation reports, we're able to better understand what's effective in terms of impacting chronic health conditions in states across the nation. As I mentioned, we often fund local or state agencies with implementing the grant strategies, which we typically do by utilizing what we call the CAAPIE framework. This framework was developed by the Chronic Disease Prevention and Control Program in 2019, in part based on approaches that other 1815 and 1817 funded states utilize. Each letter of CAAPIE reflects a different phase of the work as you're implementing the grant strategies. C stands for capture. That's where your organization will capture baseline data in part to identify the need and priorities of the project. As I mentioned previously, we do have performance measures and evaluation reporting requirements for CDC. The C phase allows us to capture data from your organization before any interventions take place. This gives us a snapshot of the pre-assessment, and then we'll also do a post-assessment to monitor change throughout the project period. A stands for assess. That's where your organization will do a self-assessment to reflect on the policies, practices, procedures, and processes that your organization has in place related to each of the strategies. After the C and the A, you'll be able to do the AP portion of the CAAPIE framework, which is the action plan. During the action planning phase, you'll set action steps for each of the grant strategies and also set targets so that your organization has a roadmap for how to progress on each of the grant strategies, ideally to meet the intended outcomes of those strategies. I is for implement. That's where you'll spend a bulk of the time within your organization through the CAAPIE process as you'll be implementing the action plan. All of the action steps that you set during that AP phase will be implemented at this point in time. Though you can certainly make modifications and work with our program based on what's working and what might not be working. Finally, the E in CAAPIE stands for evaluate. That's where we're really evaluating the process, the impact, the efficiency, the effectiveness of the work that's being implemented. There's really two areas of focus during the evaluation process. First, we're looking at the local level implementation. So we certainly want a better understanding of what's working and where your organization has run into challenges when implementing each of the grant strategies. The second level, though, is also assessing what's happening at the state level. Since the CAAPIE framework was developed in 2019, a big part of our evaluation focus is at seeing to what degree the CAAPIE framework that we're utilizing is efficient and effective in our work with state and other local entities. As we were developing the CAAPIE framework, we were also trying to be really mindful about what kind of data collection tool would be the most helpful for organizations, especially during the first two phases of the CAAPIE framework, where we're capturing baseline data and assessing your organization. Traditionally, our program probably would have used an online survey. So you would have received a link to complete the survey, we would get that data, spend a few weeks analyzing it, and then may or may not have shared it back. That didn't really feel like a way for your organization to be able to utilize data to help develop an action plan and know the intended outcomes of our funding opportunities. After lots of conversations and looking at a variety of tools, ultimately our program developed what we call the Scan and Plan tool. The Scan and Plan tool is the primary data collection tool that we're using as part of the CAAPIE framework. As we were developing the Scan and Plan tool, there were three goals that we tried to keep in mind. The first is that we wanted to streamline the collection of data that our program would need for performance measures and evaluation efforts. Instead of doing an online survey and an interview and focus group and Excel files and maybe follow-up calls, we tried to streamline it so that at least the baseline data collection was captured through one tool. We view the Scan and Plan tool as a one-stop shop to really get context about where your organization is at before the interventions begin. The second goal was to develop a tool that would help drive and monitor change within organizations. We know that agencies have a lot of competing priorities and a variety of funding streams. Sometimes CDC grant strategies aren't super intuitive, and we don't necessarily expect organizations to know every intended outcome of our specific cooperative agreements. Our hope is that through the Scan and Plan tool, each organization would have a sense for what the intended outcomes were for the grant strategies and where they should be going to best achieve those. We certainly don't want to be overly prescriptive in the type of work that your organization is doing, since it may vary based on staffing and capacity and community context. But we also wanted agencies to feel like they had a little bit of guidance about what was expected through the work that they were doing to advance our grant strategies. So our hope is that we have a tool that helps you drive change and that we can monitor it throughout the process to see what kind of impact you're having as you're implementing the grant strategies. Finally, we really wanted a data collection tool that was actionable and timely. We didn't want you to have to wait a month or so in order to get the data back that we were collected. We also don't want to collect data just for the sake of collecting data. So we tried to identify data elements that would help you decide what would be most helpful and effective to include within your action plan to best meet the outcomes of the grant and funding opportunity. After we developed the Scan and Plan tool, we wanted to see if it was in fact a good data collection tool to use as part of our CAAPIE framework. We first utilized the Scan and Plan tool in February of 2020 with 16 clinics who were funded under our 1815 cooperative agreement. After we received the completed Scan and Plan tools, we did focus groups with 4 of those clinics to hear what their experience was like in completing the Scan and Plan tool. We asked where they ran into challenges and parts that were confusing. We asked what was helpful about the tool and also asked for any modifications we could make to our process or the tool itself to hopefully make it more user-friendly and streamlined for organizations. As a result of that feedback, our program started incorporating changes into the tool to hopefully streamline the data collection efforts and make it more user-friendly. That included the addition of the Action Planning tab to better link the Scan and Plan tool to the action plan. We also created additional guidance, including this video series, to better provide background and context for organizations to effectively utilize the scan and plan tool as part of their action planning process. As you'll see in the other videos, our program is continually evaluating and capturing feedback on the tool to always make sure it's an effective data collection tool to utilize in our CAAPIE framework. We hope that gives you a better sense of the intent of the scan and plan tool and how it fits into our CAAPIE framework. If you have any questions or need assistance, please feel free to reach out to the Chronic Disease Prevention and Control Program at the email address listed on the screen.